Growing up in a Caribbean background, we have interesting views around mental health and what wellness looks like. My dad would ask me, whenever he asked me how I was doing, he'd say, "How are you doing? Are you doing good, great, or grand?" And I look back as an adult and I think that's kind of funny because it didn't really leave a lot of room for other emotions. And so as an adult, I saw that as me not being able to process negative emotions well, or sit with them or deal with them. I went to a conference for Black physicians and they started talking about mental health, and they started talking about maladaptive ways in which we in the Caribbean culture has dealt with health. And they quoted things that I heard my own family said. And I was shocked because I thought this was unique to my family. But I was in a room with people who were saying verbatim things that my family members have said to me. And that got me really interested in mental health, Black mental health specifically, how culture, but as well as our experiences in the world influence how we interact with the mental health care system and how we treat our own mental health. So I decided to start doing my PhD in epidemiology because I was really interested in data. My current research is on access to Black mental health for Black Canadians and how we can improve that. Something that I'm interested in is quantifying how much Black people access mental health care and how that can differ based on ethnicity. I think mental health is even more important than our physical health. I think we can have physical illness, we can even have mental illness, but I think our mental health is what enables us to have really great relationships with other people, great relationships with ourselves. It's what motivates us to work and to live life fully. As I engage and have leaned into, I think, thinking about and focusing on my own mental health, within my own spiritual walk, I felt like faith has only encouraged me to be more honest with myself. When I look at the Bible, or when I look at Jesus or other folks that were in the Bible, there's just such a strong engagement with their emotions. To think of God as a God that grieves with us and goes through our ups and our downs with us, a God that rejoices with us, it was really helpful to think through. And so as I engage with and try to learn more about mental health, I really do see my faith as something that really enables me to lean into the experiences that I'm having. My name is Mercedes, and this is my story.